Warm greetings to one and all. Today I'm going to take a video on Misoprostol. Myself Bhuneshwari, currently pursuing 4th year BSc Nursing from SNS College of Nursing. Before we get into the video, what are the things we are going to see is introduction, definition, dose, route, frequency, mechanism of action, pharmacokinetics, indication, contraindication, and lastly nurse's responsibility. First, introduction. Misoprostol is a synthetic prostaglandin E1 analog, initially developed and approved for the prevention of stomach ulcers caused by non-steroidal anti-inflammatory drugs. Definition: Misoprostol is a prostaglandin analog used to reduce the risk of NSAID-related ulcers, manage miscarriage, prevent postpartum hemorrhage, and also for first trimester abortion. Dose, route, and frequency. Medical abortion, combination with mifepristone, 200 mcg oral, 800 mcg buccal. Medical abortion, misoprostol only. 800 mcg vaginal, sublingual, and buccal. Early pregnancy or missed abortion, 800 mcg vaginal. Cervical ripening and labor induction, 25 mcg vaginal, 25 mcg oral. Now, mechanism of action. Uterotonic action. Misoprostol acid gets attached to its receptor that leads to inhibition of adenyl cyclase that leads to reduction of CAMP, central second messenger, leads to entry of Ca2 plus through calcium dependent channels that leads to increase intracellular calcium level that leads to uterine contraction. Next, pharmacokinetics. Absorption. Rapidly absorbed from GI tract. First pass metabolism. Extensively metabolized in liver. Metabolism. The active compound is misoprostol acid. Elimination. Primarily excreted through urine. Indications: medical abortion, induction of labor, management of miscarriage or early pregnancy, cervical ripening before surgical procedure. Now, contraindications: allergy, hypersensitivity, previous uterine surgery, fetal distress, inflammatory bowel disease, porphyria. Nurse's responsibility before administering misoprostol. Perform a non-stress test to assess fetal well-being before giving the medication. Ensure an IV line is placed as per protocol for potential emergency intervention. Keep an antidote for uterine hyperstimulation such as terbutaline at the bedside. Inform the patient about the procedure, potential side effects like cramping, nausea, vomiting, diarrhea, fever or chills, and what symptoms to report immediately. Example: severe pain or bleeding. During the procedure, continuously monitor the mother's uterine contraction and the fetus heart rate. Use electronic fetal monitoring to track the fetal heart rate and document the findings. Monitor for and manage any adverse effects such as GI upset. Immediately alert obstetric providers about any concerning findings, including concerning fetal heart rate patterns or signs of uterine hyperstimulation. After the administration, continue monitoring for at least 30 minutes after the dose and for 60 minutes after any episodes of tachysystole, frequent strong contractions. Be prepared to assess with or perform intervention as ordered by the physician, such as administering an antidote for hyperstimulation. Remind the patient to report any severe cramping, bleeding, or other bothersome symptoms and to avoid alcohol and GI irritating foods. Now, let's get into the conclusion. Misoprostol is an effective medication with wide-ranging uses in obstetrics and gynecology, but its efficacy and safety can vary depending on the specific application. It is a safe option for reducing NSAID-induced ulcers and is effective for medical abortion, labor induction, and treating postpartum hemorrhage. However, combination with other drugs such as mifepristone may offer higher success rates and faster abortion intervals in certain cases. Its use in women with previous cesarean sections requires caution due to the risk of uterine rupture, although some evidence suggests the risk may be low. Thank you. I hope you all understood the misoprostol through my video.